Retina Rounds Podcast number 18. Today we welcome a very special guest to the Retina Rounds Podcast, Dr. Jean-Pierre Hubschman. Dr. Hubschman is the co-founder and CEO of Horizon Surgical Systems, a company that is bringing robot-assisted ophthalmic surgery to reality. In the podcast, Dr. Hubschman talks about how the integration of robotics, real-time advanced ophthalmic imaging, and artificial intelligence can help ophthalmic surgeons improve their outcomes and potentially open new avenues for microsurgical intervention. Let's check it out.
So welcome everybody to our weekly Retina Rounds podcast. This week, I'm excited to introduce you to Jean-Pierre Hubschman, one of the great vitreoretinal surgeons and now entrepreneurs in our field of retina. JP, welcome to Retina Rounds.
Thanks, Steve. Super excited to be part of this podcast and discuss different things about UCLA time and the new position at Horizon.
Well, that's great. Thank you for being here. For those of you who aren't familiar with Dr. Hubschman, Jean-Pierre, or JP as we call him.
JP probably better. Nobody knows me in the US with Jean-Pierre, so JP is probably the best way to call me.
Well, we have a lot of wonderful international listeners, and it's just fantastic that you're with us today, JP. So tell us where you went to university and how you first became interested in medicine.
Okay, so interesting question. Actually, in my family, pretty much everyone was a doctor. So it was not really a question for me. And I was really interested about the field, but also it was like the natural way of moving on. And so I applied for a med school and got in med school in Lille. So it was so many years ago. And then so it was in Lille, which is North Paris, and then I was interested in ophthalmology, so moved to the south to did a residency there and fellowship there, and then I was in private practice in France and Spain. But I started being interested by medicine because of my dad and my family and so on. And then ophthalmology was nobody in my family was a nice surgeon, but it was really a field which was so interesting, mixing medicine, surgery, and I was really passionate about this even before starting ophthalmology. So it has been a great journey, and I loved it. I loved everything of it.
And so when you were in Lille, what was that medical school like? Was it sort of a classic European or French medical school, or was it avant-garde?
Yeah, first of all, med school in France is easy to enter. Pretty much everyone can enter med school. So as soon as you have something called the baccalaureate, which is after college, not college, high school, you can apply and get in pretty much anything. But after the first year of med school or law or whatever, you have a big exam, and only at the time it was 20% of the people were getting into the second year. So you can enter even if you are not a good student initially or before, but then the first year is very competitive. So Lille is a pretty, regular med school. It's like, as I said, the north of France. It was, nothing really particular.
And when you finished med school, you applied to ophthalmology. I recall you were in Marseille, which is a very special program, and maybe you can tell us a little bit about that.
Yeah, so the system in France, when you finish med school, you apply for residency, and so it's like a pretty competitive, and you pick a different place like the big city, and so I was accepted in Marseille, which was a very interesting residency program. But it was a long time ago. It was not structured as it is in the US. When I actually arrived at UCL, I realized how the training was different. In France, the residency was, I mean, you learn a lot by yourself and by going and getting some mentors, but the structure of the training program itself was not as I would say, as structured as in the US. But Marseille is a very interesting medical school. It's on the French Riviera, so nice place, great weather. So I spent a few years there for the residency and the fellowship.
And who was your fellowship with? Who would you say was your great mentor in Marseille?
So two people. One was François Devin. He was actually a fellow when I started my residency program. François Devin is one of the best um, retinal surgeon I know. He's still in Marseille. He's a great guy. I mean, he's a fantastic surgeon, fantastic person. So he was one of my mentors. And the second one was Didier Ducournau. So Didier Ducournau was um, in Nantes, but he was at the time in Europe probably one of the most renowned surgeon. He's the first one who started to peel the ILM, and he was very, very controversial, but at the same time, an amazing surgeon. And during my residency program, I spent time going to Nantes, meeting with him, seeing how he was doing surgery, learned so much from him. So my two mentors were really Didier Ducournau and François Devin, both very different, but both of them great people, fantastic surgeon, and I learned a lot from them.
Well, it's obviously you have a lot of natural gifts as a surgeon, but the way that you approach surgery and think about problem solving brings both the avant-garde of Didier and the classical training from Francois. And it's really rather amazing that you were able to trans um, transit that journey and come out the way you did. So
Thank you.
you came
Thanks.
to,
I mean, yeah.
Go ahead.
No, I mean, look, it's true that they are very different. As I said, Didier was very controversial, but an amazing way of doing surgery and another philosophy of, just doing what's really needed to the patient, be quick to try not to damage anything. Just you enter the eye, you do the limited amount of things which are needed inside the eye, and you leave. Um, and both again had very different ways of performing surgery, and I learned from both of them. And um, I really enjoyed doing surgery. I really enjoyed when I joined the UCLA, and we'll probably talk about this later, and enjoy teaching the fellows. But it's true that the way of performing surgery from my training in France was probably different from what is seen in general. Anyway.
Well, I think it's very important to get to this because you ended up with a way of critical thinking, a methodology of critical thinking, not only in the way you approach surgery, but the way you teach it, and now in the way you're starting to automate it, that is fascinating for our listeners around the world. And so your journey brought you to UCLA. I was fortunate enough to recruit you from France after you participated in pioneering what became, I guess, the 23 gauge system, but it was this minimally invasive vitrectomy system. And you were a big part of the European team that innovated this huge step forward in the way we approach surgery, faster cutters, smaller incisions, using the trocars, and improving the forceps and improving the other intraocular instruments was a big part of it. And so when you came to UCLA, it became very obvious that you were not only a great surgeon, but a great teacher. And maybe you can talk to our listeners about what it was about teaching that gave you so much excitement.
So first of all, I would like to thank you for bringing me to LA and UCLA, because you were the third person who in my career has really changed completely my life. And I'm so grateful to you it was not easy to move to the US. You helped me and created that position at UCLA at the Sinai, and I'm super grateful. And I really enjoyed the time I spent at UCLA with you. And so I'm again, thank you very much. Uh, Now, regarding the teaching, you know what, um, I'm not sure exactly what was different from maybe other teacher, but I think that surgery to me is three things. It's vision, processing, and dexterity or manipulation. And it's very important for the young surgeon to understand that you need to look at things properly and identify when you do the surgery what matters, what does not matter. And then from that information, process properly what needs to be done to, let's say, peel the membrane or cut a traction or so on. So I try to go from not just like let them know, no, that's not great or that's great, to try to go through the whole um, thinking process on what to look for, what to look at, how to analyze this information, and then how to perform the manipulation inside the eye. And so we had those Friday morning round. This is something I enjoy so much. I'm not an early bird, but every Friday I was so happy to wake up and to go to UCLA and spend time with the fellows and my colleagues and look at the case from the past week with the fellows and try to analyze properly why things went well, why things were not as well, and try to teach them how to improve.
Well, it clearly became contagious for you because using both Alan Buzz Krieger's dedication to teaching and your dedication to teaching, you imparted that to many of our trainees, and that was really, really important. And I would just say that I appreciate you giving me credit for helping you, but really it takes a village, and it was the whole family of people around us that were able to bring you to UCLA and help germinate that part of your career. I would say this, besides making sure that we had high quality pastries at Rounds, you
Yeah.
also had high quality insights for the trainees and for the faculty. And what's interesting is that now you're teaching a robotic system how to do surgery, and then you were teaching a human or humans to do surgery. And so it was in some ways, a very natural transition for you. While you were at the university, you became not only very enamored with teaching, but also very enamored with, or even more enamored with innovation. Can you speak a little bit to how that stimulated you and why that was important to
Sure.
you?
So first of all, I think that um, I've been always super interested by surgical technique, instrumentation, medical device, and so on. And so I'm sure you remember very well, but when I joined UCLA, it was the CASIT, which is the Innovation Center at UCLA. You introduced me to that center. And the Da Vinci platform, it was 2006, the Da Vinci platform, which is the first robotic surgical platform FDA approved for laparoscopic surgery, was there. And CASIT is a place where you have surgeons and engineers sharing new technology, trying to develop new technology. And so when I looked at this robotic system early on, I realized the potential benefit for ophthalmology. And as I said, I was interested by technology, by um, innovation. But what really brought me there, I think that as a retina surgeon, as you are, and as many people listening here are probably, we deal with the complication from others, meaning we realize that the level of experience and expertise and skills is very different from one surgeon to another. And I've been always interested by trying to address that, to find ways where we can limit the variability between the surgeons. And robotic is a perfect example. I think that by providing better precision, better um, processing, better visualization, all the processes which make surgery successful or not, as I mentioned before, we can help surgeons do a better job, becoming the Michael Jordan. Everyone can be the Michael Jordan of retina or cataract or using these technologies. So this is the reason why I started to be interested. And over time, I with your support and some other supports, I've been able to build a team at the Stein and the UCLA with engineers, bioengineers, surgeon, and trying to develop a technology combining visualization, machine learning, and robotic to help address these problems I just mentioned.
And so that's a pretty revolutionary idea to automate or democratize surgical outcomes and to control the things in the OR that should be controlled or are controlled by the very best of us, but are highly variable for the rest of us. And so this is a big challenge. And what gave you the inspiration to really try and do that?
So initially, I mean, when we started 15 years ago, AI was not like, what it is today. And so the goal at the time was to build a robotic platform dedicated for retina where we need more precision to help retina surgeon. And 10 years ago, Jacob Rosen, who is a world expert in surgical robotic, joined the team, and we had some other people joining, and we realized actually that retina was a great application, but AI was starting and super powerful um, capability, I would say, and that we could actually build the Tesla of surgery, meaning we could bring to surgeon a platform combining visualization, processing, and manipulation, a high level of manipulation, allowing them to do a better job and to do more. And by putting all those things together, we realize actually that we can provide some level of automation. So automation, by the way, is a spectrum between like in your car, you have the lane assist, which is just a limited assistance, to the full driving car, like the Waymo, where there is no driver. So we can provide the same thing, some level of automation or assistance using those robotic platforms to help surgeon um, see better, process better, and manipulate better all the different anatomical structure inside the eye.
Yeah, I liked the analogy that you used of an autopilot in an airplane. An airplane pilot, we would never get on an airplane without a pilot, at least not yet. But we also don't want to be on a commercial airliner that doesn't have GPS and it doesn't have radar, can't see through the clouds, doesn't know the weather, doesn't know the position of other aircrafts in the area. And so adding this type of benefit or capability to a surgeon's environment should be able to help them quite a bit. And you're sort of doing that with your real-time visualization and image guidance and so on. So, but the real question I have here is not so much what Horizon is doing, which is amazing. And I should tell the audience that I'm conflicted. I am also a director and a co-founder of Horizon. But what I'm interested in for our listeners is how you came to the realization that this was something that was worth doing for you as a human. Like you are so brave to me. You left everything in France and you moved to the United States. And I remember you showed up in my office and you said, I have no keys. I have no house. I have no car. I have no keys. And I offered to give you a key and you said, thank you. I'm going to go to Tahiti for a few weeks. And then when I come back, you can give me all the keys again. But that was a very brave reinvention. And then you were at UCLA for, I don't know, 15 or 20 years and
15 years.
and
So
published and have these amazing grants and this incredible history. And then all of a sudden you did it again. You maximally incubated this project at the university and looked around for somebody to run it and decided that you would be best. How did you find the inspiration to reinvent yourself again?
So I'm not sure if it's inspiration of craziness. So when I left France, I had a very successful clinic in France. Everyone was telling me you are crazy. Just stake here. I mean, I had everything. It was like, you know, great clinic, great environment. I was successful financially. So, and I decided to leave and restart, as you mentioned. And so I restarted pretty much from scratch at UCLA. But at the time, I felt that this that was what I wanted to do, and I didn't want to regret in the future. And I thought that I would push and do everything to make it successful as well. And I really enjoyed the time at UCLA. I think that I was pretty successful at UCLA as well. And so, as you mentioned, again, like a few years ago, I was like faculty at the Stein Eye, very prestigious place, very stable, and we had this program. Um, but as you said, I mean, I could have found someone else, but it's not that I did not think that someone else could do the job or could do better than me, but I thought that without my energy, and at the time when we started, it was very difficult, someone 200% committed and so on, that would not probably work. And so I knew that it was a very risky move. Actually, afterwards, I realized that it was even more risky than I thought at the time. But I thought, look, we have one life. I've been working on this for 15 years. I really think that it can become a technology helping revolutionize or at least improve surgery in ophthalmology. And I said to myself, okay, let's do it. And I did it. Now I'm super happy. The first year I did not share with you, but the first year was terrible. I was like wondering, why did I leave? Why did I do this? Because it was super difficult to um, ad- adjust with this new position. I mean, I've been trained to be a surgeon, to be a doctor. I've never been trained to be a CEO or an entrepreneur, and I didn't know how to deal with investors, to deal with board members, how to build the team we needed. So it was super challenging. I was really not in my comfort zone. So the first year has been very difficult, but then I've kept pushing, and today I enjoy it, and we need to keep pushing because we are at the beginning of this journey. But yes, it was a very risky and crazy move, but I'm happy I've done it.
Well, we're all happy you've done it. You and all of your 40 or 50 or 60 employees, whatever it is now, and all of your investors and your strategic partners. Everyone's looking to Horizon to democratize surgical outcomes and be not only in cataract surgery, but in the retina and in glaucoma and other areas. And it's really a remarkably brave and important move that you made. One of the issues that's fascinating to our listeners, and frankly to me, is the transition from your identity as a surgeon to your identity as somebody who's still trying to help patients recover their vision and prevent visual loss. But instead of doing it one patient at a time, you've made a move at the second half of your career to try and do it for everybody. And does that satisfy you a little bit? Does that ambition, it's a bigger swing, so to speak.
Yes, but I think that we have the right technology, we have the right team, and I don't want to miss this opportunity. And when I say missing it, missing the ability to bring this technology to market, providing consistent superior outcome for our patient. And I really believe, and I'm super confident that this technology will solve so many things.
So when you
Um,
say superior outcomes,
yeah.
tell our listeners how the Polaris platform at Horizon stacks up against the best-in-class human surgeon. So, for example, in terms of dexterity, precision, or in
Okay.
terms
So
of something as simple as moving the instrument out of the eye,
so
how
so
does it
many
stack
ways.
up?
So many ways. Okay. Surgeon, as I mentioned before, it's vision, processing, in manipulation or dexterity. In terms of vision, human surgeon cannot look at the OCT and the digital microscope at the same time. I mean, you cannot today perform whatever surgical manipulation by looking at the OCT. You have a cross section, it's almost impossible, and merging those two image modality or even more image modality at the same time, it's just impossible. Robotic system can do that. So they can use multimodal imaging capabilities with incredible detection capabilities. So vision is much better. Now, in terms of processing, the system can learn from millions of surgery. We, as a surgeon, we learn during our residency and part of the career from hundreds, thousands of surgery, but it's a limited amount of surgery. Those platforms will learn from unlimited amount of surgeries. And so they will gather this knowledge, improve optimized trajectories, improve all the settings during the surgery and so on. And in terms of manipulation, I mean, the human surgeon, human hand is like at best 70, 80 micron. This technology will bring less than 5 micron precision. So you stack up like vision is better, processing is better, is faster. Like time reaction for a human surgeon is 250 milliseconds. It's 20 milliseconds with this technology. In terms of dexterity, it's better. So there's no way this technology won't be better than us, meaning it will really help us become a better version of ourselves. So it's not like, by the way, replacing us, it's helping us. It's like the LASIK or refractive surgery. 20 years ago, surgeons were using blade to do RK, and it was like, okay, it was not, but it was not consistent. It was not predictable. LASIK came and changed completely the story. And LASIK is pretty much like a robotic system with visualization and automated laser delivery. So what we do is the same, but with surgical instrumentation for cataract, and we'll do it for retina and glaucoma, where we help surgeons achieve a much better outcome at every single time.
Right. So just to be repetitive, you're not proposing that your robot will replace a surgeon. You're proposing that your robot will augment a surgeon by creating instrument trajectories and no-fly zones and improved visualization, improved decision making, and the surgeon will be present and approving and participating throughout the procedure.
That's exactly right. So it will help surgeon. And again, in the decision-making process, I mean, here the system can assess pretty much everything during the surgery, so many different variables, and can help you make the right decision. So again, on every level, this platform will help surgeon achieve better outcomes, be faster, and as you know, the number of trained surgeons, the number of nurses is going down every year, and we'll have to address this enormous amount of patients for cataract and for retina and glaucoma and others. And this technology will really help us. So we should not be scared. We should embrace this because anyway, it's not a question of if, it's a question of when it's coming. And it will help us in medicine. It will help us in so many other different fields, but it's for the good.
Which is spectacular. So now that you're, 2-3 years into being at Horizon, how many years have you been there?
So it's more than 3 years.
More than 3 years.
Yes, we incorporated the company in 21. So it's like almost 4 years that I left UCLA and led the company.
So would you do it again?
I mean, it's the question is yes, but it's like when I left France, and I started at Stein, if I knew before leaving the challenge of setting up in a new country and restarting from scratch and so on, I would probably not have done it. So it was good that I didn't know before doing it. Same thing here. If I knew how difficult it was, the financial environment was terrible. I mean, it was really difficult. Now I enjoy it very much. I really think that we have an amazing technology. We have an amazing team. Yes, I would do it again. No question.
Thank goodness, because I think you're about to change the world. And when you, aside from the robotics, when you
Yeah.
think about over the last 10 years, what do you feel have been the biggest innovations in retina surgery or retina care? What is it that what are the innovations that inspire you and why?
Um, so actually, on the medical device part, it was not inspiring me. It was making me frustrated. You know, for instance, the cut rate. I mean, going from 5,000 to 10,000 to 20,000 to 25,000. I mean, to me, it's like not completely marketing, but those incremental change in medical device in retina were not like disruptive enough. It was like not enough. Nowadays, all those stem cells and gene therapy, which are like, well, which will change as well how we treat many conditions. But in terms of medical device, I was actually frustrated. And this is one of the reasons as well why I've been pushing for this, because we need to think big. We need to disrupt how surgery is done. It has been done for so many long time. I remember actually 20 plus years ago when the Avilance, Cheng brought the Avilance, the Decaline, and all these things. That was like changing ways of doing surgery. But over the last 20 years in retinal surgery, it was no major change, and we needed like a big change. Now, yeah.
Well, I think that's amazing, JP, and the fact that you picked up exactly where I was going. It was the stagnation of or the relatively incrementalization of movement towards what you felt was possible that inspired you to be brave enough to go and do this. So let's end by talking a little bit. Imagine yourself back in France or finishing your fellowship when you were there. And a lot of our listeners are early in their career and they are brilliant. And, one retina surgeon or ophthalmologist is smarter than the next, but not everyone is as brave and willing to strike out into the wild or wilderness as you did. So, what would you say to them when they're thinking about the passion of their project? What advice would you give when people are making career choices, whether to go into industry or academia or private practice, and how to incorporate innovation into a career?
So I would, I'm not sure if I'm the best person to provide this kind of advice, but I mean, first of all, don't be scared. Think big. Uh, do not regret. Meaning, just do what you think you want to do and what you like, and just don't feel like the ceiling. I mean, there's no limit, and don't listen to others who are telling you no, it's not possible. Just think big and follow your dreams.
Well, Jean-Pierre Hubschman, thank you very much for spending some time with us today on Retina Rounds. Your career is an inspiration to both the entire global retinal community, all of your former students, and most importantly, your colleagues, especially this one. So thank you for doing what you do, and thank you for sharing some of your story with us. And best of luck to you as you try and raise the level of surgery around the world and help surgeons help patients. It's just spectacular what you're doing, and I'm so proud to call you my friend and brother. Thank you very much for what you're doing. And I should also shout out to one of your former students, Dr. Prasad, whose vision for Retina Rounds has been so
Yeah.
impactful for so many.
Yeah. So thank you. Thanks, Pradeep, as well for organizing this podcast and inviting me. I mean, it's a pleasure to share with you some of my um, last years during this podcast, and hopefully we'll keep moving with this technology and help surgeon and patient in the next few years.
If you're interested in meeting Dr. Hubschman in person, please reach out to him at Horizon Surgical Systems. It used to be that he could welcome everyone all the time, but now he's gotten a little busier. But I'm sure he'd be happy to hear from you. JP, thank you very, very much.
If you enjoyed this video, please visit us at RetinaRounds.com. There you can sign up for our email list. You'll get a notification every time a new video is posted. And if you have an interesting video or a tip or trick that you'd like to share, please follow the links on our website and you can upload your video there. Thanks so much for watching.